Hi everybody, Dr. Cary Yurkiw here. Thank you for watching this video, and today I'm talking about why you shouldn't crack your own neck. And a lot of people come into the clinic and they say they like to crack their own neck, and I tell them not to. Today I'm going to explain why you shouldn't do that. So I'm just going to switch screens here, and when people crack their own necks, what they do is they kind of turn their chin and their head like the image on the screen, and they twist their neck. And sometimes it cracks, sometimes it doesn't. I've seen people try to do that to other people, like friends or family members, and crack their neck. But if you don't know what you're doing, it could cause some harm. I'm going to show you today what I mean. So first of all, in the neck, there's 7 cervical vertebrae. So the unique thing about the neck is each vertebrae is a little bit different. Like the first vertebrae right here is a ring. And then that ring sits on top of this peg called the dens. And the dens comes from the second cervical vertebrae. So it actually holds the first vertebrae in place with this peg or this dens. Because the first cervical vertebrae is freely movable. It kind of rotates and it can bend and twist very easily. Also, the spinal cord, which I'll show you in a second, is going through this hole right here, coming from the skull, going right through the center of the vertebrae, right through the ring. So the spinal cord and then the nerve roots are coming out between each vertebrae on the right and the left. So there's lots of nerves and there's lots of blood vessels in this area. Then, as we get down to C3 and C4, the vertebrae become much more consistent in their appearance. The angle of the joints is on an angle and lying one on top of each other. So the angle of the adjustments in the neck are very important and different from the middle part of the spine, the thoracic and the lumbar. So you definitely need to know how to adjust the neck in order to get a good adjustment. And so as far as the nerves go, there's C1 right here, there's C2, C3, and these are numbered based on the vertebral levels. And some of these nerves form the brachial plexus, which is the big nerve coming from the neck, going under the armpit right to your fingers on both sides. And then the nerves in the upper part of the cervical, C1 and C2, actually turn upward and go above your eyes and to the side of your head. This is called the greater occipital and lesser occipital nerves. So these vertebrae and their alignment's very important for the nerve flow. And then as you can see here, there's arteries running through the vertebrae as well. There's the vertebral arteries, 2 of them, and there's 2 carotid arteries right in front of the vertebrae. So if you don't know what you're doing, and if there's an underlying condition, or you don't know how to diagnose a condition like misalignment or a disc or a variety of different fracture conditions, then you could do some harm. As a chiropractor, we are well trained at adjusting the spine. So we're going to be very careful with the adjustments. We're going to do the proper adjustment for the area, and that's going to help to realign the vertebrae and allow the proper spacing between the bones. So what will happen with the adjustments is you're going to get realignment of the vertebrae, proper spacing between the bones, pressure release on the nerves, so you're going to feel better. The muscle tone will change as the vertebrae realign, and you're going to have proper shape of the discs, because with realignment, the discs which are between the bones are going to go back into the right shape. So leave it to a chiropractor, a professional, to do the adjustments. I can remember going through chiropractic college and how long it took for me to be comfortable palpating or feeling the bones in the neck, doing the adjustments, and then being confident with the adjustments that I was doing. Now I'm 30 years into practice and I've done over 100,000 neck adjustments. So it's actually quite an easy area to adjust if you know what you're doing. And I really like helping people that have neck problems, because the adjustments work very quickly. They provide a lot of relief, and they're fairly easy to follow trained chiropractor. So if you have any questions, please let me know. You can comment on this post or DM me, and I'll talk to you guys soon.